Hey everybody, welcome to today's video blog post. This is Dr. Price. This week I want to talk a little bit about disc health, and when I say disc I mean the intervertebral disc. In other words, the cushions that are in between the bones in each of your spinal joints. You see, your spine is made up of a bunch of individual bones, and in between each bone is a disc. And you've all heard of slip disc, bulge disc, herniated disc, ruptured disc, all these different things. So I want to talk a little bit about how that happens, and I want to talk a little bit on the next couple videos about non-surgical spinal decompression for treatments for patients that are into chronic disc injuries and have gone further than what conservative chiropractic treatment can help with. So this is going to be a very non-technical explanation. I've actually got a drawing that I'm going to show you. But hopefully it'll explain it to you so that you guys understand, you know, when you're feeling some radicular symptoms, which means pain that's going down your arm or down your leg, or if you have friends or family that have injured themselves and are feeling this way, you'll understand a little bit about why it happens and what you can do about it. Okay, so again, the disc that I'm going to show you is in your spine. There is a bone, and then beneath that bone is a small little cushion called a disc, and then another bone. In those discs, they provide the cushioning for the shock absorption for the body. Okay, so I'm going to flip over here and I'm going to show you what I'm talking about. Okay, so this is a healthy disc. Now we're looking at this disc from the top. So if we took your spine and put this camera down coming from the top of your head, this is what a disc would look like, and it would actually be a perfect circle. This is not a very good circle. Actually, not a perfect circle, but it'd be a better circle than this. But the disc consists of several different things. Inside the disc is what's called the nucleus pulposus, and it's kind of a hard, like the center of a donut. And then around that nucleus is what we call annular rings. And those annular rings keep all the disc fluid inside of the disc, and they give the disc its strength and its shock absorption. So if you have a force that comes down, like if you jump and you land on the ground, that force comes down, that weight is distributed in this disc, and all these rings are the support system that keeps that disc from blowing and then allows it to be a shock absorber for the body. It's a brilliant system. So this is what a healthy disc looks like. And it's important to understand that the way that this disc gets fed is it does not have its own blood supply. What happens is the bones that sit above it and below it are its food source. And through a process called imbibition, that's I-M-B-I-B-I-T-I-O-N, whenever you move and whenever those spinal segments move, whether you're bending or twisting or doing whatever, it kind of sucks the nutrients out of the bone. And this is okay. I know that sounds like it might deplete your bone and be a cause of osteoporosis or something, but it's not, because your discs are full of bone marrow. So that will actually provide a very, very good nutrient source for your discs. So what happens in a weakened disc? Well, what will end up happening is you've still got your nucleus pulposus, but through either a trauma, that's a case of an injured disc, like you fall, or something heavy falls on you, or you get in a car accident or something like that, some kind of trauma, or through degeneration. Now, the way degeneration occurs is whenever you have a spinal subluxation, which if you want to learn all about that, you can go up into the search bar and type in subluxation. But whenever you have a subluxation and that joint that I just talked about loses its normal motion, then what happens is when you're bending and twisting, that joint's not moving as much as it used to, so this disc starts to lose its nutrition and it starts to starve. So over a period of years, you'll see these little annular fibers here that used to be good and strong, they start to get weak. And then as you continue to add pressure and as you continue to add weight and poor posture and different things like that, and these discs continue to starve, you start going through a degenerative process, and these fibers will start weakening. And then some of them will actually split and allow some of this disc material to seep out, which then puts abnormal pressure on this ring right here, which is already weakened because it's being starved, which allows that fluid to push out further, which then puts pressure out here. So eventually what we end up with is a bulging or a herniated disc. Okay, this is where you get the bulging, herniated, ruptured, etc. And if this disc is pushing on your spinal cord, or if it's pushing on one of the nerves that come off your spinal cord, that's when we start getting those radicular symptoms, or those symptoms that can go down your arms or down your legs. So that's when you get into that situation. Now, Just because you have a herniated or bulging disc does not mean that you're in trouble. There was a study that was done, and they took, for every 10 people that they took off the street that were not symptomatic, that were what we call asymptomatic, they did not have any symptoms of low back pain or radicular pain, out of every 10 people, 7 had a bulging disc. So you can be treated for this, and you can be treated very conservatively and help relieve that pain. So how you can treat it conservatively? Well, the first thing that we do is the chiropractic adjustment. We start moving the joints around and try to get that disc to where it's desensitized and it's not on that nerve anymore, to where you can get the relief. Well, what happens if that doesn't work, or if it's gone too far? Then the next step that we do chiropractically is we do non-surgical spinal decompression, which I'll go into that further in the next couple of videos. And that is a very, very non-invasive, very painless technique, and it's very, very effective for treating disc issues. And it's a wonderful way to stay away from steroid injections, surgeries, neuroablation, all the different things that the medical route has to offer. Now, sometimes those are necessary. Sometimes an injury might be too severe even for non-surgical spinal decompression, and if that happens, we will, of course, refer you to the right place. But in a disc injury or in a low back injury that is chronic and has not responded to chiropractic care, the next step is to go into non-surgical spinal decompression, and then you start going into the medical route. So tomorrow we'll talk a little bit further about the decompression, and then what your other treatment options are, and hopefully make you guys experts about this, so you know exactly what to do if that ever happens to you. As always, my hope for you is to take control of your health before your health takes control of you, and I will talk to you next time. Have a great day. Bye-bye.